Hey guys, welcome back. So today I'm feeling a little bit under the weather, so if I'm low energy or I fumble over my words more than normal, which is just part of what I do, but if I do it more than normal, that's partly why. But we're going to talk about selecting, administering, scoring, and interpreting assessments today. Um, let's see, let's just jump right into it. There's a whole bunch of stuff that I want to say as we go through this. For those of you that are following along with the past assignments, we just kind of came out of our statistics section where we did a few lectures regarding the math and understanding assessment scores and communicating those scores a little bit, although we're going to talk more about that next week. And then also just interpreting the results of those things. So we've kind of covered a little bit of that here. So there's going to be a continuation of that conversation to some degree. So first of all, a couple things. One of the things that some of you may want to be doing is building a small little library of assessments or tools that you'd likely use. Now, you're not going to collect and store everything because there's simply not enough space in your world to know everything. Ideally, what you want to do is if you go to something like the DSM-5 and you say, okay, what are the conditions in here and how would I know if somebody had them? Some things you can gather from self-report from clients, but there are plenty of things that you just can't know, and sometimes clients don't know how to talk about them. And so assessment tools for some of the more challenging conditions are probably going to be important. And for some of the more common ones that are not necessarily quite as challenging, you might want to have tools at the ready to just assess everybody as like a screening tool. For example, the PHQ-9 is something that happens a lot in medical communities. I'm not sure how much people actually use it in counseling communities. I've heard people say things like, it's too basic for what the level of information that counselors need to know. However, it's totally appropriate for some situations where all you need is basic information. It's kind of like a starter to get you a little bit of information to go into an interview with or something like that. But having a small library of assessments can be a good idea, some of which you're going to say, I need to have these ready when I have my first client with an eating disorder. I need to know what questions to ask and how to actually screen for, is it a clinically significant condition or is it not? That's kind of part of what we're wondering for ourselves. I've given you, if you're part of the class, I've given you the a bunch of things to start with. However, it's absolutely not a comprehensive list. Part of the reason for it not being a comprehensive list is because depending on where you go, some of you are going to work a lot more with employment assessment. Some of you are going to work more with clinical diagnostic assessment. Some of you might work more with medical conditions, depending on the age of your clients. And so there's just so much, and I can't possibly give you something individually specific to your site. That's what supervision is for. That's what you're going to do with the people within your community as you go out and start working. So what the class is, and I guess philosophically, the entire educational process is about giving you the foundations or the basics of how do I choose an assessment? Where do I go to get them? How do I find them? That kind of stuff. So that's what we're going to be talking about today. And if you're like, well, I want to know specifically what I need, that's just something you can't get until you get out later. So building a small library, you can ask yourself, do I want to start doing that? At least have some things ready with the complete understanding that you're probably not going to be building that library until we find out what you specifically need later on. So just so you know, I give you some things, but there's more that you're going to want to pick up later. Another thing about assessment that I don't think everybody realizes coming in to the counseling world is many of us have been to a counselor and we've been given an assessment before. But the topic of assessment is so much more broad in scope depending on the kind of work that you've been doing. And some assessments, like the Beck's Depression Inventory, some of those that we've been using up until now in the class, they're really basic, they're free, you can find millions of versions of them all over the internet. You probably want to make your own for your own site later on. They exist in a lot of places, and many of them are free to use. And I'll give you a bunch of the free ones too. However, some tests are expensive because they're owned by a company or they were developed by a person, and that person, for all of the work they do, they have a right to charge for that tool. And what that means is that you have to push that expense off on the clients. And so these are business decisions that likely most of you won't make initially in your practices, but you may want to make those someday. For example, if somebody comes in and says, hey, Aaron, I suspect that I have a learning disability and I want to find out, and you, let's just say it's you, not me, and you're like, I want to learn how to assess for those things because I want to work with people with learning disabilities. But the tools that I might use are expensive and they cost money. And so if you've ever been to a specific evaluation or a specific assessment that took a while and you go through these formal standardized tests, you might know that they are kind of expensive. However, the more you talk to people who do these kinds of assessments, the more you realize it's not that they're just like making bank off all this, off just like spending all this time doing assessments. There can be plenty of profit to make. And some people specifically focus on assessment as a way to make money. Oftentimes, what that means, and some people don't do it this way, but oftentimes what that means is that by charging a lot here, it allows me to do other work over here for less money. So I can see clients for longer or do more therapeutic services if I do charge more for assessment upfront or something like that. Some people take pro bono clients because they can afford to do, because they do more assessments that allow their business to function so they can do these other things. Those are, that's a bigger conversation about the process of assessment and which ones you choose to use. But just so you know, this stuff, there are people out there getting rich off of this. And in my humble opinion, maybe it's not so humble right now. I think there's an element of potentially greed that comes in when people are making a lot of money off of the assessment of other people's illnesses. However, my experience has been that the majority of people are not doing that. And it legitimately is because either they cost that much or it allows them to do other kinds of work that they don't get paid for as much. And so it all levels out in the end for the benefit of the client. If that's the guiding post, then it usually is. So anyway, a lot to be said about that one. I just went on a little tirade there, but lastly, can you find all the information you need without using formal tools? In other words, do you need to buy a fancy test if you can just get that information via interview? This is one of the hard things that I will explain throughout the class, and you'll get more about this when you're in supervision, and you'll be continually learning about it throughout your career, is what's the best way to get information? And what do I have access to? Can I trust and rely on the client's self-report? Do they even know enough about what they're talking about to give me accurate information? Am I trying to assess something that's inaccessible to them in words? Like when we talk about intelligence testing, some of those things like memory, you can ask people, do you have a good memory? But they have to walk through some steps of a test to find out how good is it, something like that. Those are things you just can't get unless you use a tool. So under what circumstances and what kind of information you need to use a tool to get at the information, that's what you're going to be learning. And then also, can you get it fast? Because assessments have to be quick. The more you learn, for those of you that are going to do like clinical work or diagnostic work, the more you learn, especially when it's in like high acuity situations, people in crisis or trauma, or I mean, I guess this is probably true of anybody who comes through your door and you're like, I have 1 hour to do an assessment, to come up with a diagnosis out of all the different things that people could be experiencing. And then I have about a half hour to write up a report on that or something, set a treatment plan and set some goals and that kind of stuff. And that's a fast process. I don't want to freak anybody out at this point, but one of the things you'll get practice with as you get out into your internships and beyond when you're getting supervision is, how do I do that quickly? And what situations require me to slow down a little bit and gather more thorough, go through a more thorough process, and what can I just bam, bam, bam get done? So don't let that overwhelm you right now. Throughout this class, we're really slowing the process down and pulling back and saying, okay, what are all the things we can think about? What information do we need to be cognizant of? Because at this point you're learning, probably for most of you, depending on where you are in the program, probably most of you are still at the place where you're kind of freaked out about all this. And so paying attention to both yourself and your development and your clients, the context of them, and all of these sort of holistic understanding of what's going on in their lives, that's a hard thing. So right now we're slowing down to be able to focus on both you and your growth, and also understand the clients from this, from a really sort of zoomed out perspective. So you can take into consideration family situations and educational situations and just like all kinds of stuff that we're trying to pull in right now. As you get better at this, it's really going to come more automatically. You're going to have these like gut intuitions about what kind of things you need to know and what things are red flags. But that takes time to practice that. So We're not quite there yet, but just so you know, you're going to want to be quick about these things. There'll be a lot more to say about that as we get through the class here. Okay, let's talk about selecting assessments. First of all, we need to identify the type of information we need. One thing we'll get practice on in some of our class assignments is the first thing you often know about a client is where are they coming from? What's the referral source? Did they walk in off the street and because they heard about you on Psychology Today? Or are they being sent over because grandma wants Johnny to be seen by somebody? And so we know that grandma has a vested interest in what goes on there, even though there are confidentiality concerns with minors and whatever. Those are all important parts of, we need to hear about what she wants out of the counseling sessions to know how to do that assessment. Court-appointed clients, people that are in for substance use evaluations, for parenting evaluations, for, like I said earlier, for learning disabilities. If we know why people are coming to see us, oftentimes from a referral source, then we can gather just a lot more information about what we need. So sometimes this happens in the screening process when someone calls in to make their first appointment. They say, I'd like to see a counselor because I'm having some issues with my marriage. And you're like instantly, okay, well, I can draw on my understanding of family systems or evaluations about the typical things that go on between couples that are challenging. And so that gives you a ton of information about how to narrow down what are you actually working on or what are you actually going to be assessing. So we'll get more practice with that one later. Identify information available, as it says up here. I kind of already alluded to this, but do you have prior records? Do you have an intake interview that somebody else already did? Do you need to do your first intake interview with that person? Are there collateral sources of information like, grandma brings in Johnny? Well, grandma would be considered a collateral source about something going on with Johnny. So what do you have available to you and what do you not have available to you? We actually did this assignment in class a little bit ago, identifying those two things. Frankly, there are a lot of situations where you may want to know stuff, but you just don't have access to that information. Client doesn't know it, and you're not going to go, get releases of information for 400 people in their family history or their family tree to go find out. That doesn't work that way, So what do you have and what do you not have? Then determining the method for obtaining information. If there is something you know or that you want to know and you can get access to that, how are you going to do that? Does that mean you're going to have the client come back for another session, or will continue on the assessment process later? Or do you schedule a 3-hour time block where they can get this evaluation? Can you refer out for a neuropsych eval or just a psych eval or some other kind of thing in the community? How you're going to get that is important. We've talked about like methods of observation and that kind of stuff later. So there's a whole lot more to talk about there as far as like how can you get information. But we're going to keep it simple for now for our purposes today. If you need that thing about developing and expanding your library, there are ways to go about finding assessment information. That's one of the things I want to spend a little bit of time on. Number 4 here. So looking for other tools, one of the questions I get a lot from students is, well, where do you go? How do you find things? And I'm going to work backwards, actually. So this right here above my finger, it says Facebook groups. Excuse me. In Montana, and it is partially true around the country, we can just put in like social media in general here. But in Montana, we use there's a Facebook group that lots and lots of counselors use, and occasionally I'll hear things like, what tool do people have available to assess this kind of thing? It doesn't happen as much in the mental health community, but in the rehab counseling community, there's a lot more talk about what tools do you use for career exploration and guidance and that kind of stuff. And so online social networks can be really great for that. Listservs are also another one. It's not social media per se, but professional associations often have like an email chain or some kind of online forum where conversations like this will happen. And so it's basically just your access, and here's the other one, your access to colleagues, people who have more experience, who do different kinds of work. You can draw on their experience and learn from them. And that's probably the most important or the strongest places to find out information. Because it's one thing to go do a Google search and say, well, let's see what we can find. It's another thing to say, what do people actually use? And is there somebody who could provide me training if it's a more complicated test or something like that? So definitely how you build a network of people and how you draw information from that network is going to be your most important asset. Initially here, you're probably just going to go to your supervision site and your supervisor is going to say, here's what we use, here's how we do it. But there probably are going to be situations where you're going to say, okay, well, I need to find out another solution that my supervisor doesn't know. So who else can I ask? Something like that. So there's a few options there. Your textbook is full of information of important tests and things that you might use. Again, is it everything? No. There's plenty more that you're going to use depending on your specialization. But you can keep your textbook around for that purpose if you want to. You don't have to. I know how people rent textbooks and sell them back and all that kind of stuff. But it's not a terrible idea to go through and make a list of all the tests that in the particular area you think you might need. Professional organizations, I kind of already talked about that one with listservs and that kind of thing, but that's a really, really important one. The people you connect with professionally are your link to finding out information about that, your area of interest. And so lean on that one as much as you can. I know, I'll leave a little side note here. I know it's expensive, and I know it seems like it doesn't necessarily make sense initially at the beginnings of your career of why you might join a professional network, but the benefits are numerous, not just in terms of like understanding assessments and finding those out, but there's so much more. I'm not going to go into that in detail, but professional organizations can do a lot for you. And the more you get out into the profession, the more you'll probably realize a little bit about that. So, of course, I already mentioned internet researching, research literature. So if you have access to school libraries, you will while you're in school. You probably won't when you get out of school. But one of the things that we as professors can do is if you call me in 2 years and say like, hey, this is how it always happens. Hey, Aaron, I don't know if you remember me. And I'm like, of course I remember you. What do you want? I hope they don't say it that curt, but of course I remember you. And I have access to a library. And if I can help you find some tool that you don't have access to, that's just a network. That's just sort of staying in touch with people and having resources available to you. And universities are a resource for future learning and current knowledge. At least we're supposed to be. So even if you don't have access to all that, which Google Scholar does a pretty good job of at least giving you abstracts. And if you can read the abstract of an article, sometimes, not always, but sometimes they'll put in like what tests they use and that kind of thing. So, even if you just look, you have a test and you want to find out information about it, sometimes the abstract will have enough like reliability and validity data to help you with that. The mental measurement yearbook. Now, this is something that's probably really important, but I'm going to kind of breeze over it only because I've heard of this thing for a long time. And to be honest, it's one of those things like I should probably know about, but I just don't. And so I'm not going to lie to you and say like, oh yeah, it's really important and you should use it. It's super cool, because I just don't know, to be honest. I was talking to somebody the other day and they were like talking about the Beatles. And I was like, I've actually never heard a Beatles song. I mean, I've heard the songs, but I've never heard a complete song. I've never listened to a full Beatles song all the way through. And they were like, oh my gosh, how are you alive? Do you live under a rock? And I'm like, I mean, technically, yes, because my shingles are made of rocks, but that's not what they meant. Anyway, this is one of those things where like I missed out on significant portions of pop culture, and I think I missed out on a significant portion of assessment considering I'm teaching this. But the Mental Measurements Yearbook is essentially this giant book that goes through and lists all kinds of assessments that people use. Now, it's not just assessments for clinical practice, it's also assessments for research purposes and that kind of thing. So you get, it's like looking through a phone book. You can get so much detail about all kinds of different tools and information about them. I just can't tell you much about how to use it because I frankly never have. So that's one of those things you should probably go do. Go listen to the Beatles. Go watch all the important movies. I should probably do that someday, and I just haven't done it yet. And I should probably go find the Mental Measurement Yearbook and explore it. I just haven't. So sorry. Okay, lastly, there are places that sell assessments, and especially if you're going to use them for a specific agency, if it's for one client, it probably doesn't make a whole lot of sense to go out and spend a bunch of money on assessments. But if you're working at a clinic that sees lots of, I don't know, kids on the autism spectrum, or adults with couple issues, and you want to go buy a specific tool or pay for a training for a specific tool, there might be future investment in that. And so one of the places you can look is, in fact, maybe I should go to one of these. Well, I'm not going to click on them now because I'll lose my captioning up top, but I'll show them to you in class, or you can go out there and look at par.com or Pearson. Just type into a search engine Pearson assessment, because Pearson, the publisher, is different than that, but sort of. But you can go in and look for different assessments underneath different category headings, and you can get, in some cases, you can get samples of reports to kind of see how their reports look and what kind of information they actually collect. And so you can't necessarily see everything that you'd want to know to make a decision of whether it's a good test or not, but you can do quite a bit of exploring. And so I have another video in class to walk you through the websites and kind of how to find information, and we can maybe do that this week too. But those are good resources for you to find out about what tests are available. Okay, now moving on. When you're selecting assessments, this is part of that chapter 3 where I said we're going to continually bring up this issue of diversity and multiculturalism and that kind of stuff. When you're buying a test, you always want to consider, does this fit my client? Is this actually going to find the information it needs to? That's that validity stuff we talked about last week. If it's a valid test, it's going to tell me what it intends to tell me. However, if my client is from a minority population or has a disability of a certain kind, if that test is not going to get the information accurately, then you probably don't want to use it. So when selecting a test, always, always, always think about, is it going to get me the information based on those sort of cultural concerns, based on diversity, based on physical functioning, something like there's all kinds of things to talk about there. We've talked about that a little bit last week, so I won't go into that in too much detail. But you'll look at the norm group, you'll look at the language the test is available in. Many tests are available in multiple languages. Look for, does this test provide information on accommodations, and will that work for my client? Some tests will, in fact, in most manuals, I shouldn't say most because I don't know if this is true, but in many manuals of tests, it'll say exactly how to handle accommodation situations. So if the test needs to be read aloud and it's typically not, then sometimes you use different data for scoring, something like that. Sometimes it just says, you can read this test out loud, but you have to do it in a certain setting or something like that. So usually there'll be some guidance from the test developers. And then when selecting assessments, last one here, evaluate and select an assessment instrument or strategy. So I don't even know what that means. It seems kind of redundant. Evaluate and select an assessment instrument. That's exactly what the whole slide is about. So I don't know what I was thinking there. We'll just skip over that one and pretend it didn't happen. How about that? Okay, well, maybe this will tell us, actually. Evaluate the instrument. So how do we do that? How do we know? We talked about reliability and validity last week. So here's some questions that can help you do that. What's the purpose of the instrument? Who's the intended population? Okay, these are things that probably most of you intuitively know these, but it's worth mentioning here. What's the makeup of the norm group? Remember that we talked about that last week? The norm group is the people that the test was validated on, meaning if I get a score from my client, are they representative of the people that took the test to find out what is normal? That's the norm group. If the test was normed on a bunch of white college kids from the East Coast at some, I don't know, Ivy League university, does that fit my young Native American rural Montanan client here? It's kind of comparing apples to oranges. So that doesn't make sense, right? By the way, I would say that most tests are pretty widely normed, especially if they're going to be sold. Most of them, they put in a lot of energy and effort to find representative samples. And of course, you decide for yourself and read through the manuals and that kind of stuff. But generally speaking, I put quite a bit of trust in the test developers to make assessments that are quality and credible. Now, there's larger conversations to be had, of course, about who the developers were and culturally is it appropriate and all that kind of stuff, and absolutely have those. But it's okay to go out and, if you're purchasing a test, to say it's probably okay to start thinking about using it, and then just talk to people about how they use it and whether it's appropriate and that kind of stuff. But to assume that most tests aren't going to do what you want because you work with this really special and unique population, it might be throwing the baby out with the bathwater. So just take that into consideration. Number 3, are the results of the instrument reliable? We've talked about that. That's going to be in manuals. It's going to be in research papers, and it's not going to be on some guy's website on the internet. Although I have a website, or I used to have a website where I put some of that information on there. There are some good websites that are absolutely credible and valuable. For those of you who do rehab work, there's a place called the Shirley Ryan Institute somewhere in Chicago, and they have this website called rehabmeasures.org. I think that's the website. If you type in rehab measures into a search engine, you'll probably find it. But they got a huge grant to have this ongoing project to develop and collect assessments related to rehabilitation. Most of them are more related to occupational therapy and physical therapy, but I know there's been an interest in the rehab counseling community to put up some more psychological measures, and they have some there. I just don't remember. This is a few years ago when I looked at it last, but as far as like the utility of them, I'm not sure where it stands today. And depending on your clinical practice, of course, you get to decide for yourself. But the information on validity and reliability is up on websites like that, but also check manuals and that kind of stuff. Okay, enough about that for now. Does the manual provide a clear and detailed info about administration procedures? They're not going to leave you hanging. If you're paying for a test, the developer should tell you how to use it and should explain the process. So look for that and ask about that. One of a very common tests for in the vocational counseling world is called the CAPS system. I'll show you a little bit about the results from that in class, but as far as administering it, I've met at conferences, I've met the people who run the company, and they're like, I will absolutely come to your class and do a demo, and I will show you all this stuff. And they're so great. These people want to sell you their tests because they want this information to be used and found out in the world. So it's not just like they're motivated to sell you something. They also just care, and they take a lot of pride in their work. So they want to make sure that you have the tools and resources to be able to perform these things and use them in your jobs too. So lean on test developers and test sellers and that kind of stuff if you can. Also, get good at learning how to use tests so that you don't have to lean on them so much. Because I see some people also be like, they didn't spend 15 hours with me explaining how to do whatever. And so I'm like, yeah, but you can read the manual, right? Like you can figure it out too. So there's a little bit of responsibility on you. And by a little bit, I mean a fair amount. So anyway, does the manual provide information about scoring, interpreting, and reporting results? That stuff should be in there as well, not just administration, but all the other pieces through the life cycle of using a test. That should be there too. Is the instrument biased? Kind of already talked about that with norm groups and that kind of stuff. And then also, we talked about this, I think it was maybe week 1 or week 2, something like that, but what level of competency is needed to use the instrument? If you're out on the PAR Pearson website and you're looking through these tests and you're like, wow, this one sounds very complicated, and this one's really, really expensive, and is this something that I even would feel comfortable and know how to do? Well, there's a possibility that you're not even really qualified to purchase it. Remember the levels A, B, and C? A, generally speaking, A means undergraduate or open to people who aren't trained. B means graduate level work, who has information or knowledge on a test development slightly, has more knowledge about clinical applications, that kind of stuff. And then level C is sort of like doctoral level for the really complicated and high stakes tests. I wrote this, show Carl's email. Carl Sheperis is the author of our textbook, and I was on a listserv with him where they were having a debate about what students or what counselors in general can do and what level of testing they can perform. And some people say, well, because we get trained at the master's level, for most of us, we can only do level B tests, and people aren't trained well enough in their programs, and they don't know enough about anything or whatever. And then Carl's like, but you can know stuff, and you can get really good at these things, and you can perform tests at level C if you have appropriate, if you have a good ethical compass, and if you've received appropriate training and appropriate supervision and all these kind of things. And so he was like, I like to call these things nerd fights, because I go to conferences and people debate all these like really esoteric principles in assessment and clinical practice and all this kind of stuff, and it's super fun. Because I like to get in those two sometimes. I'm not really a one for argument, but I do want to advocate for the potential for us to be able to do certain things or not do certain things or whatever. So they're not really fights, but they're sometimes very heated debates about some topic in counseling, whatever. So I just got to see one online. That's what that was about. Okay, continuing on evaluating the instrument. What practical issues should be considered for this instrument? We've kind of talked about these, but here's like really practical ones. How long is it going to take me? How hard is it to administer this thing? Like, how much energy am I spending? How much difficulty is the client going to be spending? Do they have the attention span or the ability to sit for a certain amount of time? Like that kind of stuff. How easy is it to score? Is it going to take excessive amounts of time? What's the how easy is it to interpret? Are they going to give me like canned paragraph responses that I'm going to have to like tweak a little bit, or do I have to write everything up? Because the time spent on scoring and interpreting is also, you know, time is money, and that takes away clinical time of being with people. And so those are important considerations, because if you do a test but it takes you an hour to write it up, that might not fit with your workload or something like that. The format, the readability, and the cost, of course, those are pretty self-explanatory, I think. But the cost is one where we talked a little bit about that earlier, and there's probably more we could say about it too. But I'm not sure if you heard that noise, but my dad is trying to call me. I told him to wait. I have important things going on. Okay, let's talk about administering. There are so many different ways to administer a test, and again, I'll just kind of fly through this list, because when you pick a test, you're probably going to know a little bit about how to administer it. And if you don't, there's some information in manuals, and you'll get supervision and all that kind of stuff. So here's a few considerations. There's self-administration. There's one-on-one, me counselor, you client. You're sitting there, I'm administering it to you individually. There's group administration. Sometimes you can use computers. Do you have a computer in your office, one that you would be willing to let clients sit at and take a test? You know what I mean? Sometimes counseling offices, if they're bigger, or even like doctor's office, sometimes they'll have like a little kiosk where when you walk in, you go talk to the receptionist, and then you go over to this thing and take a few screening tests or whatever. A lot of places will give you like an iPad kind of thing. You may have seen those before. And you'll fill out your family background and do some basic testing on that kind of thing too. Video administered. So sometimes these things can happen remotely, sometimes not, depending on the situation. Audio administrations. So for people who are living with blind or low vision, sometimes an administration can happen just, it can be spoken, can happen over the phone, can happen with translations, like ASL is another example. How is it going to change the test if there's an interpreter involved, that kind of stuff. I'll tell you a real quick example about that. I can't remember if I've already told you this or not, but I probably will tell the story later in the semester too. But I've known quite a few interpreters, and I had a friend who was an interpreter, and she said that she went to do an intelligence test with a client. And as an interpreter, you're not, it's almost like you aren't a person. You're just there to relay language between the administrator of the test, or just a person, whatever, and your client. All you're there for is to use your hands and your expressions to communicate from one person to the other. You try to keep out of it. But one time she went in and she kind of got involved in this discussion with the psychologist who was giving this test, because one of the things you do in some intelligence tests is you say, okay, tell me what this is, and they'll show a picture, or they'll say, here's a word, now explain to me what the word is. And so the psychologist said, here's the word, velvet. And so she fingered spelled velvet. And I don't remember what the client said or whatever, but she said, testing a person's recall and understanding of a word, if I have to finger spell it, is different in sign language because there isn't an American Sign Language word for velvet. There's no sign for it. You have to finger spell it. And she said that changes the testing a little bit for, in this case, for somebody who's deaf or hard of hearing because of the, how do I explain this? It'd be just like saying, some of you maybe have heard like people who live in Inuit or Eskimo communities, they have like 13 different words for snow. In English, for the rest of us, we have one word for snow. It's just snow. You could say it's wet snow or icy snow, and you have adjectives, but they have unique words for snow. And so their level of understanding of that thing is just so much more detailed, I guess. And it's similar in this situation of signing. This is me trying to pretend like I know what I'm doing, which I don't. I don't know American Sign Language, unfortunately. But it just changes the word. And so can you really compare the results? Are they valid? That was the debate that she was getting into. So anyway, moving on. Nonverbal tests, we've already talked about that too. Okay, administering assessments. One of the challenges that we'll continually be talking about, and this is one that'll be an ongoing learning process for you as you go into your work sites and beyond, is how do you explain to somebody what the test is and what their rights are and make sure they're informed about what's happening and what they can do about it and all that kind of stuff. When I say it takes practice, but it shouldn't take long, you'll have a speech that you'll get used to eventually to say, like, here's what the test is, here's how it works, here's how we're going to administer it, here's what the data means, here's how I'm going to explain it to you later, and here's what the potential risks and benefits are of doing this process. It sounds like a lot, and this list right here, it is kind of a lot, but you'll find a good way to do it. However, you want to be efficient with it. You want to be thorough and explain as much as you can, but you also want to be quick because you don't want to like confuse people or overwhelm them. And you're all the while building rapport in the process. So what kind of things should you say? You should probably cover what the purpose of the assessment instrument is. I'll give you an example here in a second. Criteria used for selecting the instrument. Why do I pick this one? Conditions under which the instrument is to be taken. Is it something that you and I are going to do together, or do I need you to come back? Are you going to be in a room by yourself, et cetera, et cetera? There's all kinds of different scenarios you might consider. The range of skills or domains being measured, administrative procedures and concerns, types of questions on the instrument, and an overview of them to kind of get people acclimated to it or comfortable with it. Types of scoring method scheduled for reporting results to the test taker, all that stuff. Okay, so here's what this might look like. We'll just use a really basic one because I use the Beck's depression inventory for just like every example that I ever use, it seems like. But somebody comes in and they start telling me about their depression. I say, hey, I think I have an idea. I really want to make sure we get an accurate diagnosis here. So I'm going to pull out a test to help us understand depression a little bit, to sort of see if that's something you're living with. There's the purpose. There's my criteria for selecting it. Why? Because it sounds like the thing that you're saying to me. We're going to do this together. It's just, I'll continue to ask the same questions, but I'm just going to kind of keep track of this on my assessment sheet here, and I might even show it to you and ask you some of these answers here. But really, we're just looking to see if you meet clinical criteria for depression. It's just going to ask you questions about, like, have you felt hopeless? Are you feeling, have you had thoughts of suicide? Those kind of things that we're already talking about. And it's just going to take me a few seconds to score it after that, and then we'll talk about the results afterwards. Okay, so in just a few seconds, or maybe like a minute, I talked about the purpose, the criteria, the conditions, and all of these things. And maybe you were kind of tracking along with me. I went through that process. If there's a more detailed or complicated test, that's going to take a little bit longer, but the process is really pretty close to that. You're still covering all the same stuff. It's just going to sound a little bit different. And then I mentioned this building rapport. One of the things that you want to relay information to people, but you don't want them to think that you're just like, okay, I got to read off the sheet and I got to, and it's going to be super boring and I'm not going to get it. I was just sitting with a colleague of mine and they were saying that they just went to the doctor's office and the doctor spent like 15 to 20 minutes explaining what the tests they were doing and what they were considering and what made sense for the symptom presentation and what didn't and why things might be happening. And they were like, I just felt so heard, and I felt like I understand what's going on in my body in a way that I have not really felt that way with other doctors. And that's the rapport building stuff. It's like taking time to explain in language that makes sense to people, something like that. So that'll change depending on who your clients are too. If you're working with kids, they don't want to hear all this stuff. They don't give a crap about what criteria you use for selecting an instrument. They just want to play with their dolls or whatever, you know what I mean? So it's age appropriate, it's client interest appropriate, it's that kind of stuff. Now when we talk about informed consent, oftentimes what we're talking about is the thing that we legally need to tell people is under what conditions will I have to breach confidentiality? You're a risk to yourself or others. If I hear of abuse of children, elderly, or vulnerable adult, those kind of things are what we're legally required. But above and beyond that, what we're talking about here with our informed consent process is how do you just build confidence and trust with people? And what things do people really need to know? Like, what are their rights? Are there any confidentiality concerns? That kind of stuff too. Okay, let's talk about scoring. You will know about the assessment before you give it to someone. So in other words, you don't pull out an assessment for the first time you've ever used it and been like, okay, I'm going to fumble through this one. And I'm not going to be able to tell you the results because I have to practice how to score it, right? Like, it's okay to use an assessment for the first time with somebody because you got to have a first time for everything, right? But don't do it in a setting where you don't have the support to help you get it right. And also, the majority of the time, you're going to need to know how this stuff works efficiently before you start giving it to people. So practice, practice, practice. That's the moral of the story here. Formal instruments have scoring procedures that you simply follow instructions, no professional judgment. So how do I say this? There are some tools that you will use that just sort of spit out a number or an answer or some result or something like that. And you can rely on that to communicate everything that's important to clients. However, in my experience, their professional judgment is almost always used in most situations. What I mean by that is that you have to decide what you want to do with the information. Just because it says like somebody scores high in anxiety does not mean that they necessarily meet the criteria in the DSM. Some tests are built to be that way, others are not. But you have to be very cautious about what a test is telling you and how to take that into consideration with all the other information that you have available to you. That's what professional judgment is even though this test says this, am I seeing that? Does it pass the smell test, basically? Given all the other things I know, do these results seem like they're accurate? That kind of stuff. So there's quite a bit of professional judgment in, but part of the reason we learn about testing and standardizing processes and objectivity is because we want to reduce our amount of bias, our amount of, if we use the mathematical term that we talked about last week, is we want to rule out error in the process, measurement error, but also just human error too. Let's see, what do I want to say? For number 3 here, some instruments require some professional judgment. Yes, of course they do. Even in, I think we talked about this last week, so I don't need to be redundant about this, but even in your process for interviewing, how are you reducing bias? In other words, how do you know that you're not seeing the world through too much of your own filter? Like, this is what I think about these people and those people, and here's what I know from my experience. How are you informing your clinical work based on not just your experience, but the experience of others, which might mean, am I up to date on the literature on this topic? If you're a specialist in a very particular thing, you probably are going to have more motivation to be up on what's going on in other communities. Professional organizations are a perfect example of this. You go and you listen to presentations from other people doing similar work, and so you're protecting yourself from just being blinded by your own experience. And so that's part of the process that we're talking about here too. It creates strength in your clinical judgment by saying, I'm part of a community that it's not just my expertise, but it's the expertise of all my colleagues that we work together on these things, something like that. Lastly, you will make scoring errors. Human errors are they just happen. If you know that you have a really important client or a really important case, or this is a part of the process that you need to be on your best game, and you know that you didn't sleep well or you had a hard client the time before, whatever, you know in those situations you're going to be more susceptible to making errors. Like, for example, today, I feel like uh, I'm I don't sound like I'm low energy and under the weather, but I feel like garbage on the inside. And I just kind of assume that I'm going to make more verbal blunders, and if I have to do something important today, like, I don't know, grade papers or something, I'm probably going to make more mistakes, right? So protecting yourself from making those errors by acknowledging your vulnerabilities and acknowledging when you're not at your best. And even when you are, we're just going to make mistakes, and that's just part of the process. So one of the advantages of using computers for scoring and using your calculator, despite the advice of your 7th grade math teacher doing all this stuff longhand, there's real advantages to using a calculator and not doing things longhand. So anyway, enough about that. How much more do we got left? I'm just going to check this is the last one. Okay. Interpreting assessment results. I think this probably goes without saying, but intimately know the test and any subscales. If you don't know the test pretty thoroughly, and what that means is open for some discussion, but it's not like you have to know everything about how the test was developed and everything. I mean, in some circumstances, you do. You absolutely do. If you are potentially going to be called to court for the use of this test, then you're going to want to know it in a lot more detail, because people will ask you questions about, like, how'd you choose this test? Why do you use that one? Is that something that everybody else uses, or is it just you? How can you prove that it's good? What are the reliability scores? Something I don't need to go into in great detail, but in my forensic work outside of this, I've spent a fair amount of time reading about the Federal Rules of Evidence, the FRE 702. The Federal Rules of Evidence say that there has to be a scientific foundation for your opinions, and part of that scientific foundation is understanding the science behind the test development, which means if you're going to use a test in your clinical practice and you go into court and someone says, how can you prove? You can say, well, science shows it. Look at this number. It has a reliability of 0.85. That's pretty good. And then you can show it, and people will be like, okay, yeah, good. You've done your homework. So in other cases, that's not going to happen. Everybody uses the Beck's Depression Inventory, the GAD-7, the PHQ, whatever. It's sort of validated by its universal use within the community. That's something known as the Fry rule, kind of. So anyway, you don't need to care about that. Know how to read the score report. We've talked about this, percentiles, T-scores. You want to know what it is that you're reading. If there are things that you don't know, that's kind of okay in some circumstances, but the more you know, the better off you're going to be. So if you're using a complicated test and you're like, I know what that T-score means, that's the only thing I know, but there's a whole bunch of other information, but I don't know what that means, let's just assume it's not important. Maybe not a good idea, right? And by maybe not, I mean it's not a good idea. I should probably be pretty clear about that one. Avoid using a single test score to make determinations about diagnosis, career decisions, attributes about a person, etc. So here's a term that I don't know if I've used in the class yet, but triangulation. It's an important assessment principle to understand. Yes, you could say, if it's that important, why didn't you tell us about it earlier? I don't know. And here we go. Triangulation means the client tells you one thing, and you also have a collateral source, plus you have a parent or a spouse or something, and you triangulate all this data. If you're doing tests and all you have is your formal test in front of you, I give you this test, and I give you this test, and I give you another one, and using all these data points, they all kind of point to the same conclusion. That's what I mean by triangulation. If I only use one, I can't verify that or consider that it has some strength or something like that if I'm not using multiple sources of information. Now, what that might mean is you have one test, you have client report, you have your own observation, and there you go. There's 3 things that can create a triangle of evidence to help support your conclusion, something like that. But it's important to know that if you're using just the Beck's Depression Inventory, and you might, in many cases, it's totally fine, especially if you've had some practice and you know what to look for when you're diagnosing depression or anxiety, some of these more common conditions. It's okay to use one test. But if you have a really high stake situation, or it's something that you're unfamiliar with or whatever, having a couple different tests is probably a good idea. So that's one of those that you're just going to have to get within your first job, or within your community, and you'll get more explanation from supervisors and sort of what's common practice. The one caveat I'll say, though, is that use your own judgment about what you think is the most important. If you don't think you have enough information to make a diagnosis, or you're really clear on what the diagnosis is, err on the side of caution. Let's say, let's do another test. Let's do it again next week before we jump to conclusions. If there's some reason to be like, you really want to be sure about this, or you want to understand the patterns and trends before you make a conclusion, there are ways to do that and communicate that with your clients. And people, generally speaking, are really understanding if you explain to them, like, before I go diagnosing somebody with a personality disorder in my first session meeting them, I need to know a lot more information about background and family history and interpersonal history and like all kinds of stuff. And so I'm going to say, I'm going to make this diagnosis for the purposes of reporting to insurance, just to make sure that we get paid so you can continue to get access, so I can continue to do my work. But before we actually sort of land on, this is what we're doing here, we want to be real certain about that. So people get that. So anyway, I'm getting a little bit off track here, but where are we? Number 3. Well, okay, we're now on number 4. Do not use interpretive reports as your clinical judgment. Well, let me read the rest of this, actually. It's sloppy, it's lazy, it's harmful to clients, and basically what that means is if you get a printout that says, this is what the results of your tests are, and we'll take the test as gospel. In some cases you can say, I trust the results of these tests, the numbers, the explanations, whatever. But what I'm talking about here more specifically is if you have a test like the MMPI, the Minnesota Multifaceted Personality Inventory. I'll talk about this in a couple of weeks when we get to personality testing. But it's a really high stakes, takes a long time to take it. It basically covers as much pathology as can possibly fit into one test that relates to the DSM. It's the kind of test that people give when you're doing a psych eval or a neuropsych eval, or if somebody's on trial for murder and they have the death penalty in that state or something. It's the one they use for sanity versus insanity. It's a big, heavy, complicated, difficult test. It also pops out a narrative at the end that says, this is likely the clinical impression of this client. This is likely what's going on with them, and this is some of the things you might be seeing. If I just take that, copy and paste it, put it into my report and say, this is what's going on with them, it doesn't take into consideration my clinical judgment, all the other things that I've observed and watched. So you'll see people do this where they just like copy and paste that narrative from the test in and don't say anything else about it. But that's sloppy, that's lazy. What you want to do is to say, but how does this fit you? How does this really make sense with what I understand as a clinician, what you are saying about yourself, all that kind of stuff. Here's another example I'll give you real quick. Many of you have taken the Myers-Briggs personality test or something like that. There's a million of them. There's StrengthsFinder and Enneagrams and color testing and all this stuff. Those oftentimes come with a description of like, this is likely the kind of person you are, and here's the kind of relationships that you have or whatever. It's okay to take that language and put it in a report or to talk to the client about it, but most people that I talk to say, yeah, some of the things were right, but not all of it was right. Some of it doesn't really fit how I see myself or kind of who I think I am. Just because it's the test that said it, you want to go through and check it out, right? Like you wouldn't say, we'll accept it all as gospel. You are this kind of person. It just don't work that way. So if you're the clinician writing about another person, you want to make sure that you put these things fit, these things don't. This is what the client said doesn't fit. This is what doesn't fit with my observation, that kind of stuff. In short, individualize it, make it personal to that person. Don't just take stock blanket answers. Okay, and lastly, this is a little bit more specific, but you can use scales, subscales within a test to compare to each other. This is a common thing that happens when there's an overall test that has individual subscales that measure different kind of symptom clusters and that kind of thing. I showed an example about this in class when I said, if somebody's having somatic complaints, it's probably a higher likelihood that if they're saying, I'm having some concerns about the things going on within my body, I'm experiencing pain and discomfort, anxiety comes along with a lot of somatic complaints. And so as you compare some somatic scales and anxiety scales, you can look at those two and say, oh yeah, they're both scoring high on this thing. So here's what I think that might mean. It might mean panic disorder. It might mean generalized anxiety disorder. It might mean a phobia or something like that. But oftentimes phobias don't have that same physiological or somatic response. So you look at those subscales, and that's what I'm talking about when I say use them within the same test to validate each other. It's just another example of that triangulation stuff. And I think that's it. That's it. All right, you guys, we made it. Just under an hour. All right, well, hopefully this has been valuable and beneficial to you, and I will just see you in the next one. All right, bye-bye.